Okay, once again, good afternoon, everyone, and welcome to our Medisoft webinar. My name is Lloyd Morris. I'm with AVS Medical, and I'll be your host today. My partner Cindy will be joining me in just a few minutes, and she's going to take you through how to verify your patient's insurance eligibility in Medisoft. At the end of the webinar, we will be able to take your questions and answer any and all questions that you may have. I want to thank you first for taking time out of your busy schedules to join us today. We believe we've got a really good agenda for you, and from the overwhelming number of people that signed up, I can tell that this is a topic of interest to a lot of people. So let's get started. But before we do, let me just take care of a couple of housekeeping items. First, the webinar is being recorded, and it will be available to you. It should be available no later than tomorrow. If not, it would be Monday morning at the latest. You will get an email, and in that email you'll be able to download both a copy of the recording and a copy of the slides. And of course, it will also be posted on the avsmedical.com blog, and we would encourage you to sign up for that as well, so you don't miss future training opportunities with Medisoft, which we plan to do several more this summer. If your GoToWebinar control panel is up on your screen, like the image here, you can minimize it by clicking the little red and white arrow there on the upper left side. And then at the end of the webinar, you'll be able to ask a question either by clicking that little hand icon that will indicate to us that you want us to unmute your phone line, or you can type a question in that chat box down there and we will answer it live. So let's move to the next slide. So what are our goals for today's webinar? Well, it's really to show you one of the most powerful features in your Medisoft software, which is the ability to very easily and quickly verify a patient's insurance eligibility. And most importantly, to be able to do that without having to call the insurance company or without having to go to their website and manually key in the patient's information. I think you'll be pretty pleased with what you see today. And lastly, we get calls and emails from people all the time with questions or comments like they know that their Medisoft does things that they wish they knew how to use and take advantage of some of the other features in there. So we really think of this as showing people how to take full advantage of their Medisoft software. So with all of that said, I'm going to go ahead and turn things now over to Cindy, and she is our resident Medisoft expert, and she's going to walk you through the details and show you how this works in Medisoft. So Cindy?
Thank you, Lloyd, and hi everybody. Happy Thursday. Let's just jump right into why would you check insurance eligibility in the first place? Certainly you want to get the most up-to-date insurance policy information from your patients because you want to verify that that policy is still active, and you want to make sure that you've updated your Medisoft with either a new case or to edit the existing case to reflect that current information. You also want to make sure to collect the correct copay. So if the patient's card is there and you want to validate the fact that the correct copay is on the card, you can read directly from your eligibility report that you're going to get for each patient and validate that you are correcting the correct amount of money, so you don't have to follow up on that with the patient in the future. You want to make sure you minimize the number of rejected claims, of course. So if you get good information up front, you're going to save a lot of work and hassle for the billing staff later when they try to get the correct insurance information to match with that visit. And of course, it is very expensive to try to research and refile claims that are either rejected because the insurance information is not up to date or it's missing some piece of information. And of course, every practice wants to make sure that they are paid for the services they render. So you want to stop treating patients for free. Placing some more responsibility at the front desk to make sure that insurance information is up to date and correct will ensure that the billing department is able to process the claims properly, and ultimately the practice is successful because the money that they are due is being collected. So in order to validate insurance eligibility in the past, or even if you wanted to do it without using Medisoft, you could certainly pick up the phone and call the payer and take the time to read to them all the information and verify that, in fact, the patient that you're treating does have a valid insurance policy. The other slow way to do it would be to get login, username, and password information for every one of the payers that you would like to validate. But of course, if you use these methods, you'll be spending a lot of time manually checking on the insurance information for all of your patients. There are clearinghouses that do have portals for most of their users where you can log in, and if you're submitting your claims to that clearinghouse, whether it be Gateway, Relay Health, whoever, they may have an area for you where you can log in and manually type in the information about your patient, and again, they will show you the eligibility report there. But if you would like to use the automated feature in Medisoft, you can do it if you are a client of Relay Health. So Relay Health results are available to you automatically in your Medisoft desktop. So in order to automate that process, the thing that we're going to look at in my live demo in a minute is to show you how every single patient who's placed on the schedule can be automatically checked for their insurance eligibility. You can either right-click on that patient's appointment and get a real-time eligibility report, or you can go ahead and turn on the task scheduler in Medisoft and tell Medisoft to go out a couple of days before the visit to bring in that insurance eligibility report. The software will put flags on the schedule, and I'll show you what those look like, showing you whether or not the eligibility has been processed. It will also put the detailed results from a 271 report directly into that patient's schedule. Scheduled appointment. I'll show you what that looks like. And it also keeps an ongoing history of every time you've verified that the patient had insurance. So if for some reason in the future you're told by the carrier that that policy was not in effect at the time of the date of service, you actually have it in your software that you did verify insurance on that date. So you've got something to stand behind there. So I'm going to go ahead and open up my Medisoft. I've got a demo practice here, so you can be assured that I'm not showing you any real patient data, and show you a couple different places in the software where you can view eligibility. The first, certainly, is if you go into any patient record and open up that patient demographics, we've got a complete list of all of their appointments and their case information, etc. But if we go into their case, you'll notice that there's a button on the right-hand side that talks about eligibility. And if I click that eligibility button, it'll open a window where I can view eligibility verification results. Now, in order to get a live report, you could go into this box within the case, and you could click Verify, and a little box will open up asking you, what would you like to verify? And in the case of a secondary insurance that is present, you can verify that one as well. And I click the Verify button, and it will go ahead and process through Relay Health, and it'll bring up what's called that standard 271 report. I'm going to click OK here. And the eligibility response, in this case it's a fake one, but it is identical to what you would expect to get from the payer. So in this case it just says that this particular patient does have active coverage, and normally if there was a copay, that amount would be printed on that eligibility report. Let's bring my Medisoft back up again. So that's how we can take a look at eligibility verification reports one by one. I want to show you how you could do that from within the schedule. So I'm going to open up my office hours here, and I've got some sample appointments for today. And I'm going to go ahead and check. Let's check on this patient this afternoon at 1:45. So a quick way to get that eligibility report is just right-click on the appointment itself and select eligibility verification from the menu. Or once you are used to doing it all the time, you can just basically highlight an appointment and click F10 on your keyboard, and that same eligibility verification window pops open. I'm going to go ahead and click Verify on this patient. And I've got little boxes popping up on my other screens here, everybody, so that's why you don't actually see that running. But my 271 report, again, is available here. Okay. So back to the calendar. I wanted to point out to you that if you notice on each of these appointments, and I'll start with at the very top with Claudia George, there is a small box to the upper right-hand corner of the appointment itself. And right now, the 1, 2, 3, top 3 appointments all have green flags. And what that should indicate to the front desk personnel is that these patients have had their eligibility checked, and the green flag means it was an active policy. If you wanted to view the information about that particular inquiry, you can just hit your F10 or right-click and select eligibility verification. And the software keeps track of every single time that you verify. So you can see I did this patient actually twice this morning. And if I highlight the particular result at the bottom, you'll see information about that particular inquiry, and it'll show us whether or not the patient was eligible, whether they were active, and then any detailed information about their eligibility regarding deductible, copay, etc. This particular patient, Virginia Langley, just has a question mark in the upper right-hand corner. That means that for some reason her eligibility has not been checked. And if I wanted to do it, I could just hit F10 and go ahead and do it. But a more automated, less manual way to go ahead and check these eligibilities is to schedule these ahead of time. So let's go back into Medisoft and take a look at how you would schedule eligibility verification. You would go into your scheduled task under activities, and it would be activities, and down here at the bottom it's eligibility verification, and then schedule.
Lettuce, tomato, mayo.
You would go ahead and set up a new task, so it's a new eligibility. And the practice I'm in is called my demo practice. I'm going to re-log in again here. And the description might be eligibility, daily. And I'm going to start it today. And I'm going to verify perhaps 2 days before. And it's totally up to you if you want to check 1 day before, 2 days before. Sometimes you want to say 2 or 3 so that the eligibility for Monday morning's patients would be running, let's say, on Friday. And here it says, do not verify patient eligibility more than once in so many days. That refers to the fact that if a patient came in on Monday, maybe you don't want to verify that insurance again if they're coming in later the same week. But it really doesn't matter too much. Alrighty, I'm going to go ahead and save that. And then we would expect that to run this evening. All right, as far as setting up for insurance eligibility, you do want to make sure that you have a few things going. One is that you need to make sure that when Relay Health is going to be handling these transactions for you, that they're set up as an EDI receiver. So we can help you do this. Certainly, if you want to schedule some time with us, if it's not done already, or if you're doing it on your own, I can send you some instructions via email. Just let us know after we'll be sending a follow-up email to everyone after the webinar today, and you can certainly reply and we'll get you instructions. So you need to set up that EDI receiver. You also need to do a little homework in your insurance carrier list. And I'm going to pick on one of my Aetnas here and open it up. Each one of your carriers under the EDI eligibility tab need to have this eligibility payer ID filled in. Now I happen to know that Aetna is Aetna. If you notice, this payer ID is different than the claims payer ID. So I wish it were as easy as just using the same claim and eligibility payer ID, but it is not. They are different. And if you don't know the eligibility payer ID, which you won't in the beginning, you'll want to click the lookup button right next to where it says eligibility payer ID. And this will open up your list, and you'll be able to search for any carrier here, and it will bring up that code that you need. So Aetna happens to be Aetna. You can certainly look for any carrier that's in their list. If you have any questions about whether or not a payer offers eligibility, because not all payers do offer it, then you would want to refer to the Relay Health payer list, which is on their main homepage of the website. It's also located in Collaboration Compass or Connect Center if you're using either one of those for Relay Health. And while I mentioned logging into Relay Health, when you first start with that clearinghouse, part of the payer enrollment is deciding who do you want to receive these eligibility reports from. Some payers require you to ask for permission to receive them, and that's part of the enrollment process with the clearinghouse. But that's usually done at the very initial setup of Relay Health, if that is your chosen clearinghouse. Okay, one last thing that you do need to remember is that whenever you request these reports, the module that's handling the traffic back and forth to Relay Health is called Revenue Manager, and those of you that are using claims, ANSI 5010 type claims, all probably have your Revenue Manager set up. And within there is a section where you go in and you actually assign an eligibility receiver for all of your carriers. And it's real easy to do, and we do it as part of the initial setup if you have us helping you. What I mean is for every single carrier here, you'll notice that the eligibility receiver is RELEV. And that means that when you request the report, it'll go to the right EDI receiver. Okay. Let's get back to here. One of the things to measure whether you're successful in checking enough of those eligibilities at the front desk is to run a report that shows you how well you're doing. And if you haven't noticed, there is a new set of reports in Medisoft under Reports, Analysis Reports, and then down here, Electronic Claims Analysis, Detail and Summary. I like the detail report. I'm going to show you what it looks like. And let's run it for today. We do have quite a few patients already. We've checked their eligibility on the schedule. Sorry, I did billing date. I really want date of service, so we'll try that again. We're going to go for, oh guys, I'm sorry, I'm clicking on the wrong report. Analysis, it's eligibility, not claims. My bad. Here we go. Appointment date will be today. And this report looks like this. So the idea would be that each morning when you're preparing at the front desk to receive patients and you want to know whether or not you've confirmed their eligibility, you can look at your list of the entire schedule and decide which one of those patients you have verified, and then really zero in on the patients that have not had their insurance verified. So if we move down to Virginia Langley, for example, when she comes in, we may need some new or updated insurance information. You can do a real-time information request on her by hitting the F10 key and getting her eligibility, and then have a short conversation with her about, what additional information that you might need in order to treat her for the day. So if, in fact, the front desk is working on validating every single patient's insurance, then the idea would be to assess where you are right now using your report. So let's say you're managing to verify at least 50%, and then set a goal for what you think the office can do as far as getting all that insurance information correct at the front desk before the patient is seen. Set a goal for that, and then just keep striving to make it a little bit better, and perhaps reward the front desk for the great job they're doing, and you can measure it through those reports. All right, Lloyd, if we could go ahead and open up for questions at this point.
Yeah, great. Thank you, Cindy. So if you'd like to ask a question, there's two ways you can do it. Again, on your control panel, you'll have that little hand icon. You can click that, and we can unmute your phone line. Then we'll be able to hear you. Or if you prefer, there is a chat box down there. You can just type your question in. We'll see it, and then we will answer it for everyone. So we'll stop talking for a few minutes and wait to hear from you. Hi, Australia. Do you have a question? Australia, I can't hear you, so I'm guessing that means you may be listening through your computer and not actually on the telephone. So in order for me to hear you, you would need a microphone or dial into the actual webinar with your phone. But unfortunately, we can't hear you. Can you? Yeah, if you can type your question in at the bottom of the panel, there's a little chat window. If yours isn't open, there's a plus sign. You can just click that plus sign and open it up. In the meantime, let me take another question here. Yeah, hey, this is a good question from one of our friends down in North Carolina, Cindy, where they, as you know, they use HNS down there. So the question is, can they use HNS and Relay Health simultaneously?
That's a good question. I'm not sure whether it's, if you have Medisoft, then certainly you can. Because what you would do is you set up two different receivers.
She does.
And so, yeah, okay, great. So yes, certainly.
So I think the answer, I believe I know the answer to this one, but yeah, you can keep using HNS to submit your claims and download your remits, and you can just use Relay for insurance eligibility verification. So that there's actually another person here with that same question. Does it require Relay? Yeah, so it does. Medisoft is owned by McKesson, or up until recently was owned by McKesson, who also owns Relay Health, and they were really two separate programs, but because they were owned by the same company, were designed to work together, sort of hand in glove. So there are other benefits to using Relay, and we'd love to chat with you about that. But if you have to use another clearinghouse, and in the case of North Carolina, you do for that particular specialty, but for others you don't. But you can use just Relay for insurance eligibility verification if you want to. Okay, so Cindy, the next question is, does it show deductibles or non-covered services?
It really depends on the payer.
Right.
And each payer has their own report that they send out. Many of them show, a very long report. So they'll have every kind of copay, co-insurance, deductible, etc. And so I would have to say that really depends on what that payer is releasing. Also with Relay Health, they're coming out with a new product, and I saw that we have some of our surgical users on the call today who may be very interested in it. It's an estimator, and I'm going to get more information on that later this week. But the idea of it is, in Relay Health, you're going to be able to, on their website, log in and put in the procedure that you're going to be doing for a patient. So let's say it's a colonoscopy or a plastic surgery or whatever it might be, and the estimator will give you the up-to-the-minute deductible, the coinsurance, everything for that procedure, whether there's an authorization required, all the information about you performing that. The idea would be that you could present that to the patient so the patient knows right away that their coinsurance is going to be this much. And they have a real good idea of, the front office has a real good idea of who's going to be paying for that bill and collecting a lot of that money up front instead of trying to come after the procedure is all done and collect all this money from the patient. So more information on that to come.
Okay. So our next question, and I think a couple of these may be the same, does it show both in-network and out-of-network benefits, and if any type of a percentage, or excuse me, if any type of a pre-certification is needed?
Again, it does depend on the payer, and I wish I could give you more of a real example. I have seen a lot of live ones. Let's see if we can.
Yeah, so while she's looking up that example, what this really shows is exactly what the insurance company report is. So it's basically the same information that you would get if you called them or if they fax you a report. It shows up in here. So so the answer to your question is yes, as long as the insurance company is providing that information.
Mm-hmm. So here's an example up on the screen, where it's telling you whether it's network or non-network, what their benefits are. But as I mentioned before, and this one, in this case, they have no deductible. It's really dependent on that payer. And I know a lot of the time, 85% of the time or 80% of the time, you're dealing with the same payers over and over again. So you'll know which ones have the reports that you need and which ones, unfortunately, you would have to follow up with a phone call.
Okay. So the next question I think may be the same, and this just may be my ignorance, but would it tell you if an authorization is needed for like a CT or an MRI? Is that basically the same thing you just?
Yeah, sometimes. Okay. Yeah, sometimes it's not as specific as you would like it to be.
Okay. Okay. This is a good question. I think a lot of people may have this workflow, which is that they don't enter new patients into the system until they actually show up in the office. So how would the verification occur then?
Right. So they would have to do it one by one. So bringing back to our Medisoft schedule here, they can't use the scheduled eligibility feature. Right. They go ahead and go to the calendar for the day, and the patient, I would suggest that you still use the calendar just because it's nice to organize your workload here. What I mean, instead of going into the patient demographics one by one, you could just leave it here so you know which ones you've checked, which ones you've not checked. You would just put the patient information in by opening up the appointment and updating the patient information. Patient's just arrived. You're going to update the demographics there. You're going to update the case by right-clicking, go to Edit Case, and go ahead and make sure that you put in their policy information. And then right from this screen, you can click on an eligibility button right here, and then go ahead and verify it. That while they're right there in the office. So it's the same idea. It's just that you'll have to verify it live, real time, instead of getting it scheduled the day before.
Okay, great. All right, let me unmute a phone line here. Karen, I'm having trouble unmuting your phone line. I apologize. I sent you an audio pin. If you enter that, I'll be able to unmute. If not, maybe just chat it in and we can answer it through that way.
Okay. While you're waiting on that, Lloyd, I just wanted to say that we did a different webinar yesterday for another group of software users.
The Medisoft sister product, yeah.
Right. And after the call, we had a lot of people who were using Eligibility or had it set up, but maybe it wasn't working properly, and now they're trying to make sure it's up and working properly. It needs a little fine tuning. So we are setting up appointments if you've got Relay Health already, and if you just create a case today by sending an email to support1@avsmedical.com. We will set up a time to get back on the system with you one day next week and fine-tune it. So, I know there seemed to be a lot of excitement yesterday about getting back in there, getting it working and running properly. So if you've got it already and you need some help from us, we can definitely schedule time to work with you next week.
Sending a question through the chat window. I think we may have addressed it, but if the provider is in or out of network with the patient's policy, I'm not sure if I'm reading that correctly. Does it still work? Or if,
yes.
Okay.
As long as the provider has been is on record with that payer. So what I mean by that is, let's say you're treating a patient and the provider is not in network, but the provider has signed up for eligibility reports through the clearinghouse for that payer.
Got it. Okay.
If I've made it clear, then they'll get reports whether or not they're in network. So what this is all about is the provider's NPI number needs to be on record with the payer, whether they're in network or not, and the carriers will allow you certainly to get eligibility reports even if you're out of network.
Okay, great, thank you. And this last question, I think I can answer this one. The question is Relay Health only eligibility, or does it do claims as well? No, it does, everything. So it does claims, it does electronic remittances, it does insurance eligibility. There's some other things that it does, like there's some great financial analytics reports that rank your claim performance against other providers in your area and other similar types of providers. So it provides those nice reports for your practice, as well as that estimation function of the patient's out-of-pocket costs. So it does everything.
Yeah. So we'll send some more information out, right, Lloyd, this afternoon after the webinar?
Going
if
to
anyone
try to
needs
get it
more
out. Going to try to get it out
that.
this afternoon, but yeah, it may be tomorrow.
Great. Okay.
Okay. Pam, I will shoot you an email with the answer to that question. We are up against a kind of hard stop here with the webinar service, and it looks like the number of questions has kind of dwindled off here. So just want to thank everybody again. It's a big crowd today, so I can tell this is a very hot topic, but we will get information out to you all today. And Allison, I got your comment there. We'll be in touch right away. Hey, thank you again, everybody. Please keep an eye on your email. We love doing these webinars, and we love the fact that everybody is excited about them. So we will be doing some other ones here in the coming couple, 2-3 weeks. Thanks again, everybody. We'll talk with you soon. Go ahead and kill her, Cindy.